Hello, good evening. Assalamu alaikum. How's everyone?
عليكم السلام. Fine, Dr. Zaib.
How are you doing?
الحمد لله. Thanks God.
Eh, That's
Yeah.
great. That's great. Okay. So, how's everyone? How's preparation? I can see that you are here. And who is there? Bishra. Okay. Manikam. Deepa. Salma. Zijing. How are you? Good to see you. Okay. That's great. So, Uzma. And I'm sorry I cannot pronounce your name. Okay, and user as well with name H. Okay. So anyway, so today we are going to have our last and final session before the November exam is going to start. So this is going to be like, I mean, not in terms of, the like our regular session, what we do. Okay, always that we will do station practice. So I'm against, the station practice online, just, the few days before exam, because if you are not, the performing well, so of course, it will lower down your morale. So my idea is that, we have to talk about that, how we can bring, the somewhat kind of, the good change in terms of our, that how we are going to spend our days before exam, 4 to 5 days before exam. So it is very much important that we should learn to focus. Number one, we should learn that how we are going to behave in these 4 5 days before exam. So it is a good idea that, if I talk to you and if you guys open your heart aloud and you can talk to me as well, that what you are thinking, what are your thoughts about, the exam, and what are you, the feeling at the moment. So it is going to be an open session, but of course I am going to give you, some of my tips, what I have followed, what I have been giving to all my, the beloved students. So of course, this is going to help maybe, the one or the all students. So it is going to perhaps, it is going to help all of you as well. So this is my agenda, that, at least we can talk, the openly. If you guys have any query, you guys can ask me. So I will definitely try to boost your morale, try to boost your confidence, whatever helpful tip I can give. So I will try to give that. And apart from that, I would, encourage all of you. If you guys have any question, if you guys have any query, open your mic and, ask me openly. So maybe, we are not going to meet before November exam. So this is going to be a golden chance for all of you. Okay. So if you guys can, any question from anywhere, if you have any query, anything regarding exam, regarding these, the few days before exam. So I'm here. Okay. So, the generally speaking, I've been through this. I know that, this is a such, the kind of stressful exam before, the stressful time before exam. Yeah. So it is very much important that, somebody should be there, who is there, like, somebody is there to tell you that how you are going to spend your time. Okay. Somebody, how you are going to, the talk, how you are going to, the behave in all these days, and how you are going to, the utilize these days, because this is very much important that, the in the end, if you are like, I mean, in low mood, like you always ask, some of the question being, the low, depressed, blah, blah, blah. So if you are in, the not in the mood to study in the end, so of course it is going to affect your final performance. And altogether, this way or that way, we all are, the studying for our final exam day. Yeah. So, the this is very much important that, you have to be very calm. You have to be very, the kind of poised in the last, the few days. Doesn't matter, whatever you have studied. Okay. It's been, the quite long you have been studying. Okay. So don't touch, the few of the things which you have never, studied. Okay. Which you never knew that, okay, I had to study this. Okay, I have come to know from, the so and so person that this is also important, but I don't know about it, you know I don't know about it, that how to go, how to, the execute this station. So leave it. Whatever you have studied so far, okay, be contented on that. Just revise your own stuff. Just revise your own points. Just try to, the revise whatever you can in this, the short span of time. So I must say that, I can completely, the relate to the feelings, relate to the situation what you guys are going through. Okay. So today we are going to talk that how we are going to utilize these few days, how we are going to behave in exam. So this is going to be a kind of quick, the overview, how we should be in the exam. So the coping strategies in the crucial and the stressful last days. So how you can the cope. This is very much important, isn't it? So how you can the kind of um, deal with your stress. Number one, the first tip is going to be from my side. Don't study too much in the last days. Neurons have a capacity. Okay. So we are all human beings. We are not robot. We are not going to feed. We are not going to fix everything in our mind. And mark my words. In the end, when the stress level is high, when you are in that mode where you think that you don't know anything, very normal feeling, isn't it? Even though I have studied for so many months, but in the end of preparation, I know I'm sorry, I don't know anything, I don't remember anything. Okay. So, in these days, you just need to be, the kind of very, very calm and poised. Okay. Second good, the advice, what I would like to give you is don't peek in all the open groups. Don't try to just go here and there. Don't just try to listen to everybody. If you really think that you need the last moment tips, okay, that is okay, but don't try to learn, don't try to engulf, don't try to digest the new things which are quite new for you. Maybe that is not helpful for you. Okay, maybe that is not meant for you. Maybe that is meant for the upcoming candidates who still have the many months to go for their exam. Don't listen to so many advices there is. Come on, it's been done. You cannot change whatever you have learned because our mind is what we trained. Okay. And it is, it has been trained so far. You cannot change your last moment, the preparation. You cannot change your last moment, whatever you have, the kind of memorized or whatever, anything whatsoever. Yeah. So you cannot change it. So this is going to be my humble and sincere advice that don't peek into all open groups. I know there are so many open groups, okay, and almost everybody is trying to, they convey a good thing. Everybody is trying to teach, something. But this is you. You have to decide that what is good for you and what is not good for you, what is affecting your mental health, what is affecting your quality of study, what is affecting your mental peace at the moment. So this is the time where you have to be organized. This is the high time where you need to be collective in your almost all effort. Okay. Plus, don't think that you cannot do it. This is the major thing what I have been listening these days from the many candidates there is. So they say, Dr. say, I don't think I can do it. I don't think I can make it. I always tell, I'm sure the people who are following me for quite long, they know me. I always say, when I can do it, you can also do it. There is no hard and fast rule. I have been the kind of student like you, of course. I still am student. I do learn from each and every one. But of course, for the exam, I have been student. So I have been in the same position. I have been in the same state of mind where I have been also thinking the same that I cannot do it. I cannot do it at all. But this is a negative feeling which you have to get rid at this very moment because this is very much important. Don't ever the think that you cannot do it. Certainly you can do it. Okay. So think about why are you doing MRCOG. This is very much important. Okay. Think about that. Why are you in this business? Okay. Why do you think that you have to give this much of effort? Why do you think that you have to give this much of effort? And why are you doing this MRCOG? Just the analyze. Be determined. Be the kind of passionate that okay, yes, I have passed my part 1, part 2. Today I have to clear this part 3 as well. Okay. I know I am much more the capable than this. So do try to believe in yourself all the time that yes, I can do because I have done part 1 and part 2. So yes, I can do the part 3 as well. So maybe the I have to give my 100%, but I don't know. And in fact, nobody knows that what is going to happen on the exam day. All right. Nobody can predict that what type of question will come and can come. All right. So what you need to do is you just have to be, the kind of very much what you can say the focused, determined. You just need to be thinking of that, okay, yes, I can do it. And I am going to do it. Okay. For me, for myself, okay, for my career, for whatever, for whatever you are doing this MRCOG. Okay. So ultimately, our goal is to become a good practitioner. Ultimately, our goal is to serve our community. Ultimately, our goal is to enhance our, the skills, isn't it? or maybe, you know, settling, you know, to some other country. Maybe, you know, everybody has a goal, right? So always think that, you know, how you are going to, you know, the reduce your, you know, the stress level. So this is high time where you need to be focused, where you need to understand that, okay, come on, you know, if I'm not doing it now, I am not going to do it, you know, the anyway, anytime, any month, you know, the any minute, any second. Okay. I have got a message. Can you explain regarding summative OSAT? Summative OSAT, what do you want? There is not going to be any question on summative OSAT. Summative OSAT is, you know, the OSAT which is being, you know, done by a person who is going to pass you or fail you, which is going to, you know, the increase your, you know, the clinical, you know, the kind of level. Okay. So it has nothing to do with part 3 exam. Summative OSAT is MRCOG. Either you pass or either you fail. This is summative OSAT. Okay, formative OSAT, yes, you know, if I'm your junior and if you are teaching me, so yes, you know, you can give me your feedback, okay? Then I can write down in my portfolio that yes, you know, I have had a session with Abir and, you know, we have had, you know, the good learning. So you can give me feedback. I can give you feedback as well. So there is no pass and fail, but summative OSAT is MRCOG. So you are going for summative OSAT yourself, isn't it? Okay, Walaikum Assalam, Atiya. How are you? Good to see you. Clear now, Abir? Summative OSAT is pass fail. Okay. Every exam where you get a result, where you get marks, that is summative OSAT. All right. Where you just get feedback, there is just feedback. You know, that is formative OSAT. Yes. Walaikum salam.
Thank you, Dr. Zaib, for your explanation. Actually, it is a station SPT for someone needs summative OSAT for episiotomy.
It is formative OSAT. It is not summative. It cannot be summative. It cannot be summative. It can never be summative. In exam, how can you pass or fail somebody? Can you just imagine? By definition, summative OSAT is pass or fail. Are you in position to pass somebody?
Actually, he missed he did not well in the episiotomy and need to change this summative to formative. We can't sign for him. This is a formative if he failed in the summative.
There must be any other agenda. There must be any other thing. Okay. It cannot be about the OSAT. So try to explore that. Maybe, you know, there is undermining bullying. Maybe he or she is upset. Maybe he or she is facing violence, domestic abuse. Maybe, you know, any kind of, maybe, you know, if he or she is going through, you know, any health issue or something. All right. So what I believe is that it is not going to be, you know, the something which you have to do in the exam. What examiner, what RCOG wants to check is that whether are you familiar with the exam, you know, the pattern or no? Do you know what exactly the summative OSAT is? Do you know what exactly the formative OSAT is? Okay. So I personally believe, because I know I'm in the same world, in the same MRCOG. So personally, I believe that this is not going to be the station where you have to talk about the OSAT only. Okay. So try to explore a little bit, try to look at the expressions, try to look at the person who is talking to you, his or her body language, his or her expressions. Okay. So try to do that. Got my point, Kabir?
Got it. Thank you.
Okay. Okay. How long
actually, Dr. Zaib, it was the station.
Prolactin in hyperprolactinemia after given bromocriptine, is it 3 months? Yes, clinically it is 3 months. This is what we do. Yes, dear. Who is this?
Yeah.
Okay, yes.
It was a station for episiotomy in which she wanted to sign formative OSATs. She booked for formative OSATs, and in the end, she was insisting you that please at least sign my summative OSAT.
Of course, you cannot
something
do that.
like this.
So you have to tell her.
You have to say that whatever you are booked for, you will. I will sign. I can only sign that. And also in this station, the role player had some kind of cut on her finger, and you have to tell her that if there is any cut or any injury, then at that day we cannot do formative OSAT as well.
Well, you know, Okay. So this can be one of the reason. Okay. Anyway, either way, you cannot sign any summative OSAT. So you can politely tell her that, look, I understand that you are pretty much upset about your OSAT, but I'm not in the position to sign it. What you need to do is that at least you have to do this procedure in the presence of your consultant. So at least if consultant give you, any kind of criteria that, okay, yes, you have done it perfectly, so he can surely pass you. But I'm so sorry that I cannot do it at the moment. Plus, I can see that you have got a cut in your finger, and I think that you are unable to perform it properly. So just give it to the few days until your finger is healed and until you are in good position to perform. So because all these OSATs are very much important for our clinical careers. So I will advise you to just wait for quite few days and then just go for the whatever OSAT you want to. Okay, so be polite, be gentle, don't undermine. So whatever the role player is guiding you through, take the station that way. There is no hard and fast rule that you have to put your agenda into the station, because I have heard from that so and so person that he or she was talking about that. I've been through, because I am taking mocks these days, so I am listening so many stories,
Yes.
because we do
Excuse me.
practice, all these stations. Okay, so more or so, when candidates are coming to me, so they are when they see the question, I know this station, I will do it like my own way, what I have practiced with this, or maybe I have changed my own agenda, maybe I have some more other questions. So this is going to be my another advice to all of you. Okay, let me come to that, because I have some exam advices as well. So this is very much important, that please don't fix your head. Don't fix your head, because I have prepared this station with Dr. Zaib, and Dr. Zaib has said that because she was behaving, or she was having this role player like this, so my exam is going to be this as well. No.
Excuse me, doctor, I have one question. Hello.
Yes,
doctor,
please.
About this summative and formative OSAT. This is according to the paper that he brought. If he brought a summative OSAT, there is one square that working to be competent, we have to make a tick on this square, then say, sorry, I can't sign for you other than this square.
Exactly.
But if he brought the paper of there is in the table paper of the formative, we can write in the formative what is well done, what is not well done. According to the paper that introduced in the question.
According to the situation, formative OSAT, yes, you can do, but not summative OSAT. This is not your domain. Okay, this is not your because ideally, in real exam they do give you scenarios like that. You are ST3 working in the ward, you are ST5 working in the ward, so you are probably seeing your junior. Yeah. Yes, I agree.
I have another question. Yes. Yeah, doctor, about the formative. I read in some groups that 4 to 5 procedure can be finished with formative, but for summative 3, 1 signed by consultant and 2 signed by the senior.
On that, what is the criteria? Have you gone through the RCOG training matrix? So every procedure has different training matrix. Okay, so it is according to that. It's not a fixed criteria. Okay. So I know
formative.
What
it is.
I know what
mean formative. It is not open number.
Of course, no. Every procedure has different. The kind of the RCOG matrix is little bit different for every procedure. I know where are you coming from. I know you are talking about episodic station. So everybody knows that formative. I know. I am in this world, like I have told you. I know each and everything. Okay. So my
in some group it is opened, formative opened without number, and the other group it is 4 to 5 only formative. Then after that, summative 3.
Why are you worried about the numbers? Just tell her that okay, what you are concerned, what is your major agenda? Just fulfill that and don't go into much of the depth. Who is asking you to take the the candidate to his or her house? No, this is not your agenda. Okay, so just stick to whatever is the task. Okay, whatever he or she is asking you. Okay, whatever or whichever the thing he or she is asking you for. So just do that. Okay, don't go into the much of the depth that okay, you have to do 4 or 5 summative OSAT and 1 of the formative OSAT, then I can you can perform this. I think it's a good idea that if you don't say openly that this is much, you can say that you have to have a couple of the formative OSAT and the summative OSATs as well in the presence of consultant, and if they sign you up, then you can also do the procedure independently. Okay.
Okay, thank you, doctor.
I always believe that we have to do this.
Yeah.
Because I don't believe in that, we have to be very strict in our thoughts that, okay, this procedure 3. So, in real exam, what will happen with adrenaline rush, with problems, with, the stress, you may forget, you may say that, okay, 7 to 8. So of course that maybe that is not the answer. Okay. So don't unnecessarily push yourself. Don't unnecessarily go into these kind of things where you think that, you can fumble, or where you have a very limited knowledge. Okay. So I will advise, don't go up to that, the extent. Okay.
Okay. Then I have a question about the labor ward priority. When I selected the cases or started one by the cases, like this routine case, I will send the midwife. She will take the history. She will take the vital sign, and I will examine her. She will examine the abdomen, contraction, fetal heart, fundal height, CTG, partogram. I have to wait the result from the role player about the partogram and CTG, or completely talking.
No. See, labor ward is always like, for example, just imagine you and me both are working in the same ward. I am finishing my duty. You are taking over. So I am giving you, if the 4 patients. So aren't you going to ask me that, Zaib, can you please tell me that, how far is she in her labor? How is her bishop? Why not
Doctor,
in labor?
If I wait the result from the role player, that suppose I want the vital sign for this patient, I want the CTG for this patient, I want the partogram, and I want the result from the role player. I can't finish 10 station in 10 minutes.
No. This is not it is. So that's why it is recommended that you practice, number 1. Secondly, you have to have an, the kind of an aerial view, okay, open view of the labor ward. You will quickly scan. If you feel that, there is pathological CTG, there is referred a patient from midwife, there is, the ruptured uterus, there is quad prolapse, pick emergency first. Pick emergency first.
Yes.
Okay.
If I took the emergency first, no problem. I want the CTG for every case. I want the vital sign for every case. I want the partogram for every case.
Why every
then I
case?
have to ask the role player.
If it is, the cold case, if it is just admitted and, she is scheduled for the cesarean section tomorrow, why do you need any kind of CTG? You will ask somebody to do all these things and move on to the emergency. See,
that means I have to keep.
Of course,
I have to keep the question only for emergency case.
Where you think that your management will depend upon your further information. Only in that scenario. If patient is booked for uterine artery embolization 2 days on gynecology list, but she is here today, okay, to get her to get admitted. So what you will do for uterine artery embolization? Nothing. You will just take the relevant information, which is very much important for that particular scenario. But if there is, the history of, the preeclampsia, patient is a known case of preeclampsia, and today she is here for, because she is having headache. So if you will not ask blood pressure, I don't care if you have managed preeclampsia and you have given, the magnesium sulfate. If you are not asking blood pressure, you are failed. Okay? Got my point? Because
that means if it is cases of the induction, yes, doctor. That means if the case of the induction, straightforward delivery, the PV or the vaginal examination normal every 4 hour increase 2 minutes, no need to ask about the vital CTG, partogram, only for a critical case.
No. I'm sorry. You are, getting this thing idea very in a wrong way. Always remember, just, try to absorb my example. If I'm giving you 4 patients, what you will ask from me? One is primary gravida, she is admitted since night. One is, the patient which has been referred from midwifery care. One is patient who is scheduled for induction today. One is the patient, who is 5th gravida and who is induction of labor. And she is for, the maybe congenital anomalies. And, I have given one, the misoprostol dose. So what you will ask me? When was misoprostol kept? No? You will ask this, okay? Because then you have to decide in your duty that what you will do in next 12 hours. So how you are going to do is that, okay, so I have got 4 cases. So for the patient who has been referred from the midwifery-led care unit, so I would like to know that why has she been, referred? What is the reason for the referral? Okay. So secondly, I would like to know that what is her current status, her gravidity, her parity, her current status, her reason of referral. So if it is because of any emergency, this is going to be my urgent priority. Okay. So there is one patient, who is scheduled for the induction. So I will ask one of my junior to look at this patient and take history, because I would like to know what is the reason for induction. And then I will ask her to do the pre-induction CTG and tell me if there is any kind of, the kind of concerning feature. So we will decide about the induction later on. And meanwhile, I will manage the rest of the patient. See, you have to prioritize accordingly. But if there is any patient who has been referred from midwifery care unit because her blood pressure was continuously high, but if you will just focus on her PV, and you are not asking about the blood pressure, so this is your mistake then. So ask wherever you think your management will be leading. Or for example, my fourth example, this is the congenital anomalies, and she is for induction of labor. So I will ask if I'm taking over, so I will ask, okay, so when she was admitted, number one. Second, when was the misoprostol? When was the induction started? Okay, is it according to the unit protocol? And when is the second dose? When we have to repeat the second or third dose, whatever it is. Okay, because then you have to manage the case in the next, in your duty time. So this is what labor board is. Labor board is not like, that you will just be a robot and you will just, read through, and you are not going to manage. What examiner wants it, they want to know that whether you can, they realize that there is any kind of emergency. Always remember, in every labor board, in every gynae board, there are going to be, the 1 or 2 cases where they really want your input that, okay, this is what, we have to do, and this is what we have to perform. This is going to be the urgent one, and this can be the routine one, and this can be the semi-urgent one. For always urgent, you have to go yourself, you have to involve your consultant, you have to involve, any of the specialists if you wish to. Then, for the semi-urgent, you will say that, okay, I will ask this person, whichever whatever team you have. And then you are going to go about, then, okay, after dealing with emergency, I will go to semi-urgent cases. Then after dealing with all of my cases, then I will go to my routine cases and check that everything is aligned and everything has been taken care of. And then I will go and I will have a quick walk, the round. Got my point?
Yes. Yes, thank you, doctor.
Okay, fine. So don't forget to ask, if a patient is laboring, so you need to know that, how far is she in her labor, and, so was there any induction done? When was she admitted? And what's her bishop? What's her, the current CTG? So if you will say, so if examiner has to tell you, something, any further information, so they will give you that information. Trust me, they will give you, until unless you open your, the kind of, if you are going to ask only, then otherwise nobody is going to help you. Trust me. Okay. So you have to, look at the labor board or whichever board you have been given to. So you have to look at that very carefully. Always, the mark in your mind that, okay, this seems to be the emergency. This seems to be the urgent case. Okay. So you can say that, my general strategy is going to be that I will be doing this labor board prioritization room by room, but I will make sure that if I come across with any emergency, but that is going to be, then I can change my priority, then I can change my management as well. So that emergency is going to be my urgent emergency. For example, you have given 10 rooms. In the 9 rooms, there is PPH. Okay. In the 9 room, there is PPH. So PPH is general because, the PPH is the problem where you can lose mother. Always remember, threat to the life, threat to the mother's life, threat to the baby's life. Okay. This is always emergency priority. Obstetrical emergency is your urgent priority. Where you have to save both, this is emergency priority. Okay. So look at the labor board. Okay. How it is going to, direct you. So trust me, the things are, I'm not saying that it is easy, but yes, it is doable. It is doable. I've been through this. Okay. So make sure that you keep your reflexes like this. You don't unnecessarily go into the depth of which is not even needed. Okay.
Assalamu alaikum, Dr. Zaib.
Walaikum salam.
Dr. Zaib, as you explained that for PPH, do you think that medical management, we need to say all dose and everything?
No. You will say that I will manage the PPH according to the unit protocol, or you can say that according to the RCOG guideline. So this is going to be my urgent priority. So I need team. So I will call for help. So I will involve every person, whoever there is, I will inform my consultant.
Yeah.
This is how you are going to do. Okay. Yes. Because it will take, I think 10 minutes.
Yeah, thank you. My next question is that void.
Yes.
Yeah, thank you. Next question is that voiding dysfunction. There is a chart, new chart. So there is written if patient cannot pass urine, okay, so she cannot pass at all. So this will do in and out catheter. So after that, we'll see how much she pass urine with in and out. That means output we'll see. So according to this, if it is less than 200 and less than 100 and 250. Sorry, yeah, 150. 150. So we'll count as according to this count we'll manage the patient. But next chart is that about the that if she pass urine but she cannot, let me it a little bit pass urine, so in this case we'll do in and out catheter also, but we'll see the residual volume.
It's always about residual volume. It's always about in and out catheter. Then of course, in and out catheter, you will see that whether this patient can be managed on day case or this patient needs admission. So that is going to be according to that. If you think that the voided volume is too much, for example, so yes, still you need to do the you can do just if there is no residual volume, okay, if the residual volume is just the normal which is the amount of the urine which needs to be in the bladder, so then it is normal. If you think that it is more than that, okay, I don't remember exact figures at the moment, so I don't want to misquote. So just quickly go through. So the so of course post PVR is the must in retention.
Because both
volume, according to the
in the chart, chart it is mentioned differently. That's why that it is written that star mark given which one she cannot pass urine at all. So there it is written the urine output, the star mark 150 ml, that one is star mark written urine output. So output means how much she pass urine. And the other chart which one is written that she pass urine but little bit. So in that cases it is written in the chart that it is will assess the residual volume. That means how much urine in the.
Yes, PVR is must. In retention, so it is by rule PVR is must.
So just to clear
sorry,
about that,
I didn't
because
get your question.
It is
sorry,
written
I have to go through.
The two section is different.
I don't know. I have to go through that chart. Okay, first myself properly because I don't want to misquote.
Okay.
First of all,
thank you.
Secondly, if you can send me your question in private, so maybe I can help, but not like this.
Okay? No, excuse me. For both of them, residual assessment. If she can pass urine, yes, for both of them. If she can pass urine or she cannot pass urine, residual
PVR
assessment by ultrasound.
Yes, PVR is must for retention. This is by rule. By rule, PVR
for
is
both of them.
By rule. This is what I'm saying. This is my general concept.
But can you check again that down last line in the chart? It is written the star mark which is 150. It is written the urine output. Just check it then, please. That's why I was
not now. I'm in session.
Yeah, no.
So maybe afterwards.
No, I'm not telling Dr. Zaib. That other candidate who told.
Okay.
Next question is HRT, the side effect. If you tell that there is irregular bleeding, that means HRT could be 3 months irregular bleeding, but it is more than 3 months will interfere you. So do you think we can, we will tell about the breast cancer and other complication also to mention the risks of breast cancer?
If it is a sole station on HRT, then yes, you have to tell each and everything. If it is not the proper, the prime case or primary case of HRT, don't go into unnecessary depth. Okay. If you just have to touch that, okay, because we are removing your ovaries, so we have to put you on HRT. So, then just, say this. These are the hormones, which needs to be, given from outside once the ovaries are removed, because ovaries cannot produce hormone. So this is going to be effective. So that's it. My idea of saying is that, if it is not your real task, don't unnecessarily go into the detail. Because, you know,
Right. Thank you.
we maybe want to tell each and everything, but maybe this is not your domain. Okay, so don't unnecessarily waste your time. Always try to think that where you can, you know, save your minutes,
Yeah.
seconds,
Thanks.
even seconds, because each second will count, each minute will count. Even the last 1 minute is very crucial, because you have to close the loop of the station. You have to ask the patient that, am I clear so far? Do you have any other question? Then you have to give her patient information leaflet. Then you have to ask her that, you know, if you have to send her to the, you know, the GP, if you have to send back to her midwife, then yes, you know, that is important. This is your exam. Nobody is going to judge until and unless, you know, the HRT
Thank
is
you.
your
The
primary
another. Yeah, a structured discussion is examiner is asking directly asking the differential diagnosis. Do you think I should start first as per tool, then I'll tell that about the differential diagnosis? If he'll ask directly question, first question.
Sorry,
if he'll ask,
I didn't get
if
the
examiner,
question.
yeah, structured discussion. If examiner asks me first question directly, can you tell me the differential diagnosis? So do you think I start first as but tool, then differential diagnosis, or I can tell
No,
directly?
if the question is differential diagnosis, tell differential diagnosis. What is the role of going for the ASPAR tool? ASPAR tool will take, you know, the kind of, if the examiner is asking you, can you please summarize the case for me and then tell me what is the differential diagnosis? Then yes, maybe. Okay. But otherwise, you know, don't unnecessarily, you know, save your energy, save your words, because, you know, everything will count in exam. Okay.
Another things you told that infertility patient, before you told that we'll check the hysterosalpingography for tubal patency. So before all induction of ovulation induction, we have to do the tubal patency test. We have to do. Yeah. What
tubal
you told.
patency test of what?
Before all ovulation induction.
Yes, that is must. That is must. Tubal patency is must. What if tubes are blocked and you are giving her, you know, the ovulation induction? Clinically, the tubal patency plus, you know, the semen analysis. These both should be normal. Okay. You cannot give any patient any ovulation induction, any infertility treatment, you know, ovulation induction, I'm telling. Okay. It's not about IVF. IVF, of course, is going to be in the bilateral tube block. Okay. So in the ovulation induction, tubes needs to be patent. Okay. Semen analysis should be normal. If you are bombarding somebody with ovulation inductions, ovary is producing eggs, but, you know, there is no pregnancy because the tubes are blocked. So what is the role?
Yeah, like compensated if we'll start beforehand.
Of course.
Yeah, thank you very much.
Whoever has question, please open the mic, because it is very hard to read, you know, this long question. So it is easy to communicate rather than, you know, read the question through.
Hello, Dr. Zaib. I'm Rizwana. Dr. Zaib, how are you?
I'm good. Yes.
Dr. Zaib, I want to ask one question. In labor board, as we are discussing, we have to apply SBR tool in every case, Okay.
No.
Because it takes too long if we apply SBR tool.
Yes, of course. Of course, it will take a lot of time, sweetheart. So if you will say that I will start my, you know, this case, I would like to know the situational, you know, the situation, then I will go the background. I would like to know why. If you really think that you need, you know, some of the background history, for example, and it is going to help your patient in this very moment, then ask. But otherwise, don't necessarily waste your time, because you have to manage. Probably you have to manage, you know, the 6, 7, 8 rooms.
Yeah, and thank you. And Dr. Zaib, one more question. During the station, if we have to, like, in what cases do we have to tell them that we are going to examine you? Like, not in every case, right? Like in like SPTs, in what scenarios do we have? They will ask us for examination.
Always remember my word. Always remember my, you know, the sentence. If at all that examination is needed for your management, okay, then you will ask her. For example, she is in labor, so you need to examine her. She is in preterm birth, she is with PPROM, you need to examine, because your management will start from your examination. Okay, you cannot admit every patient if she is coming with, okay, so you need to know that whether it is confirmed P-prom or no, whether it is confirmed P, the preterm birth or no, whether it is, the true HMB or the HMB, she is coming with HMB and she is complaining of, if she is coming with discharge, you need to examine. All right, then you will say that, okay, I have to examine you in the presence of chaperone, and then, I might need to take some swabs on you, and then I might need to do the bimanual examination as well, just to check that your womb and all these are fine, and there is no, the signs of any acute infection. Then I will be able to tell you that what exactly you are having at the moment. And for example, if at all it comes out to be that you are having a vaginal discharge, then I will give you treatment accordingly. If it is fungal, then I will give you antifungal. If it is bacterial, I will give you, this is how you are going to talk. It's not, there is no hard and fast rule. What candidates do is, please don't mind everybody. I am in online exam at the moment, but I will examine you once I will meet you in the, the real life. Do you think it is, the clinically applicable? I am having problem today. Do you want me to suffer for, the 3 years once you will meet me in the real life? No. Okay. So this is quite, the insensitive, and this is not even, the practical as well. So don't ever say that. Even in the online, I had, the face-to-face exams, all face-to-face exams. Trust me, we never had a chance that, we have to tell them that, okay, until unless we really think that, that examination will help us in our management. Okay. So don't do that. Okay. Unnecessary. It's better that, don't unnecessarily do that. Okay. Anything.
Doctor, excuse me, if live exam, I have to go to patient, that's me role player, and examine her really?
No.
Just joking.
No.
Then if the case,
we are discussing on that,
yeah, if the case she came to see the report, I need to examine her after history.
If
she
you
came
think
to see
that
the report.
If your task is that, you have to explain the investigations, then you have to manage her. Then maybe if you think that, yes, the management is going to be, the management is going to be according to your, the investigations and, your examination. Okay. Only in that case. But otherwise, don't unnecessarily waste your energies. Exam is very simple. All of you.
Suppose she came to know the result of head-to-toe scan, that the baby have Down syndrome, baby have the talipes. I need to examine her.
Do you think that, your examination will help in your management?
No.
Thank you. Here you go. So always, don't, and then, what candidates do the mistake? I recently had the mock with one girl, and my nurse will come and she will do the blood pressure, she will do the temperature, she will do this, and then I will ask you to lie down on the couch, I will cover you, I will do the examination. Is it applicable in real exam? Do you think that you are wasting your 2 minutes on this just, the examination thing? How you will explain, then how you will, you will explain your, what you want to do, how you are going to manage her. Okay. So my dear all, always try to think of that how and when and where I can save my 1 or 2 precious minutes, even 30 seconds, even 1 second. Okay. So always try to think of that where I can cut, my sentences, and I can, utilize those, utilize that time into my management. Okay. Okay. Priya, you have any question?
Yeah, hi, ma'am. I just wanted to ask about the gynae list. How do we actually answer that kind of questions?
So it's all going to be accordingly. If it is like, kind of, you think that there is a very famous scenario of latex allergy. So of course, latex allergy is going to be your, the first case. If you think that there is any bleeding patient, if you think there is any kind of, the OBS patient where you have to deal her, for example, there is a, the case which is suspected, the placenta previa accreta, or, that she was admitted because of the placenta previa. So yes, that needs to be done early. Okay, that needs to be done early. For example, if there is any case that, which is, the having any kind of, the fibroid, which is, the cystectomy, then of course, you have to talk accordingly. So always think this way that, don't always think that whatever is given in front of you and you are just going to be the robot and thus you are just going to do that. Always think, if I am standing in my OT, how I will do. Okay, you got my point. So what you do, if I have given you 4 cases, for example, if I have given you molar pregnancy evacuation, I have given you, the previous 3 scar, and she is having placenta previa, query Ekerita. Then I have given you, the one patient who is having, the breech presentation. Then I have given you one case which is just diagnostic BNC and the biopsy, okay, because she didn't want to go for pipal biopsy. Then I have given you, the one more, the kind of small case. So which one do you think that you have to go first?
The one with the Ekerita.
How about molar? Don't you think that, that is
No.
important?
Yeah.
Small case first because they will go at the same day.
No.
Okay.
Apart from that, molar pregnancy, we are having this fear. You don't think that, if at all, if we have any patient of molar pregnancy in our ward, we don't sleep at night. Every time, some junior comes and, they ask you, okay, please.
Okay.
So we always, is molar okay? Is molar okay? This is what I used to do. I don't know. I have a big fear of molar pregnancy. Trust me. I have a big fear of placenta previa because, that can bleed anytime and potential bleeding. So you have to go immediately. You have to do immediate evacuation. Okay, you have to do, the emergency. So for me, if there is a molar pregnancy as well, so that is going to be my priority, isn't it? So I will justify it because I will do the molar pregnancy because I am having this, the fear that she can bleed anytime. Plus, if she is stable afterwards, so she can go home on the same day.
Okay.
So, this is how you are going to justify your cases. If you are going to say that, if I have, the one case, placenta ekrita, like you said, so placenta ekrita can be, the prolonged, it can end up into having, the hysterectomy. So what you will do with your, the rest of the cases? You are busy in managing, placenta ekrita, and outside the theater, there are 4 patients waiting for you.
Okay.
Priya, what will you do at that time?
Sorry, if I have a placenta ekrita and there's 4 patients with me.
Yeah, 4 patients, like, the diagnostic, and it is evacuation, the simple miscarriage, and there is, the diagnostic. Let's say it is a polypectomy, simple polypectomy, and plus, the biopsy, endometrial sampling, and, the one case is breech presentation. So what you will do?
Then the other juniors would attend to those cases first?
I have only one theater. I'm sorry. And you have to do all cases. So how you will prioritize your cases? Okay, molar is done. Molar is done. Now you have to deal with these 3 and 4 cases. Yeah. You have placenta ekrita. You have 3 cases. So which one do you take first?
So if the molar is done, the placenta ekrita, then I would see which is more urgent. I think the endometrial sampling can be an outpatient, so it can be done later.
No, because she has refused for pipal sampling. So that's why she is scheduled for, the inpatient sampling.
Sorry, and the other cases were breech. So the breech should go first because, yeah.
So now there is a trick. Always remember, sweetheart, ekrita can take long. You don't know if you will open, how long it will take. Maybe there is bladder involvement. It happens, isn't it? That, we have been told that this is only previa, and when we open, okay, oh my God, this is per krita, this is in krita, this is going to the bladder, isn't it? So surgery may take, the time, the more time. So the breech, which is, the waiting. So, for example, you have taken almost 2 to 3 hours for this. And if it is uncomplicated primary breech, how long it will take? 30 minutes? 25 minutes? Isn't it?
Yes.
So you can say that, okay, so I will quickly, finish my rest of the cases. And then I will, I will quickly finish all these cases, and then I will go for the ekrita, because ekrita may take long, because there can be chances of having, sometimes the clinical findings or the radiological findings may mislead us. So the final situation is going to be evident while we will open the patient. Okay, so that is going to be my, the priority, because that may take long, and we might need to do, the extra procedures as well. For example, if there is bladder invasion and you have to do the bladder repair as well at the same time, so it will take time, isn't it? So always remember, so that the cases which are going to take, a lot of time, so that is going to be in the end, and the cases which you think can fill. See, biopsy, sampling, how long it will take? Hardly 5 minutes, 10 minutes after induction, after anesthesia. isn't it? So you will quickly take, the biopsy, you will, do the, shift the patient, and then you will call the next patient. You will do, the primary breech cesarean. If it is non-complicated, without any complication, it may take 25-30 minutes, or hardly, according to the book, if at all you have to talk about 40 minutes, 60 minutes, not more than that. Okay?
Okay, I understand. Get it.
Like
All right.
this. Yeah.
Okay.
Okay.
Dr. Zaib, if we have a latex allergy case and a molar pregnancy case, so first we have to do the molar, then latex.
Latex
No,
first.
latex.
Latex, cross-contamination. Latex, cross-contamination, then molar.
Latex, then molar, okay.
Because latex, you have to save the patient, you have to save yourself as well, you have to save your environment as well. There is going to be cross-contamination. So at least latex first. Okay?
Doctor, if we have one case with DM, DM should be first in the list, right?
If it is DM, of course, DM, insulin-dependent diabetes mellitus, then yes, first.
Then what about the insulin pump? Can I change to insulin sliding
if insulin
scale?
Pump is on arm, if it is insulin pump is on the thigh, why do you want to change it? Are you going to do surgery on thigh? If at all insulin
no.
pump is in your surgery operative, the field, then what talk says that if insulin pump is functioning properly, in a good way, don't touch it. Okay? If you think, what are the common sides of?
Even if metal, I have to change to plastic or not?
I don't think so. If it is working perfectly, why you have to do, the manipulation with the insulin pump?
Because it affected the diathermy, doctor. We have to change from metal to plastic.
Okay, in that scenario, okay, justify it. If you really think that, you have to do, you are going to change it. Okay?
Because some said, no, we have to change to insulin sliding scale. And others said, no, keep the insulin pump, but change to plastic.
Well,
where I have to go.
I just go according to whatever is written in, the books. Okay. Or, I don't go by like this, the random, the kind of knowledge. So it's better to have a, the kind of valid reference. Okay. So according to me, what talk says is, day before yesterday, I revised it. So, it says that, don't touch insulin pump. It is functioning properly. You just have to change it. You just have to touch it. If at all it is coming in your operative field. Otherwise, you don't have to, touch it. Okay. Yeah.
Okay. Thank you.
Because the common sides of insulin pump is, the upper abdomen. Oh, sorry, the abdomen, lower abdomen. Okay. It can be the upper thigh or the outer buttock area. Three areas. So if it is functioning properly, so why you have to, touch it? Why you unnecessarily have to do any manipulation with that? All right.
Hello.
Okay.
Hello.
Yes. Hello.
Hi, Dr. Zaib. This is Sabine. I have 3 questions. One very quick questions. So one is in a gynae priority list. There was a patient, I don't remember. There was a patient with gynec surgery, and she was having a right hip replacement. So I just didn't know about how to put her on priority list.
Right. No, it was not about priority list. It may be about, the safety. For the any replacement, any metal, any, the kind of, the which side of the, the metal is there. You are not going to put the diathermy pad on the same side.
On that side.
It is going to be on the opposite. This is patient safety.
Okay.
You are going to put this, so the current is going to pass on the same way, and the patient can get burned.
Yeah. So we will put the diathermy plate on the opposite side, right?
Opposite side.
This is only the measure in this case. No prior.
Yes.
Okay. And doctor, one more question. One candidate asked you about the differential diagnosis. So in a structured discussion, when I supposed to tell the differential diagnosis, do I need to justify myself that based on this could be my differential diagnosis?
Yes. In structured discussion, you just need to justify. Justify. Whatever you want to say, justify. I want this because I want to see this. I want this because I want to do this. I want to do this because, this is going to help me. I want to do this because, because is always there.
Yeah. Okay. Yeah. Okay.
Dr. Zaib, there is a patient with twin pregnancy for ERCP, and she's very anxious. So what is the role of they mentioned twins and anxious, or in some there is she's depressed, she's very conscious for the surgery. What are these clues? So what are the cues in this?
Evacuation, you mean?
Evacuation.
Oh, sorry. I got, ERCP, cholangiography. Okay, fine. Okay. I thought maybe, the, okay, fine. What is the role of depress?
She's very anxious, and they mentioned the twin pregnancy. So the twins means the big size of uterus or what? Why they mentioned the twins? And she's very anxious.
Everybody will be anxious. If I have to go for evacuation, I'll be anxious. If I have to go for any of the surgery, I'll be anxious. But, just touch this point that, I would like to know that what is bothering her at the moment. Why is she, anxious? Is it just because of the surgery, or is there any other agenda? But this is not your list. This is not going to, the kind of hamper your list. Okay. So, if at all, you think that, she is very anxious and, you want to ask. So, of course, you can tell her that, so maybe, if I don't have any other urgent case on the list, so I might take this patient, on the first list, because maybe, she will have, the more anxiousness with the waiting as well. So this can be, the agenda, maybe, according to me. Okay. Because I don't know the clear scenario, because, this is what I can think of. Okay. Okay, great. Okay, fine. So let's move on to guys, because I have to, speak a bit. So let me go through, the effective strategies to, the cope stress. I'm sorry, it is soup stress. It is not. So effective, let me correct it. Okay, effective strategy to cope stress. So how you are going to do that? It is very much important, isn't it? So you need to be very much, the calm. You need to be very, very, the cool while you are, the doing your stuff, because this is, the high time where you can get, the every kind of stress, of course. So let's talk about it. Okay, stay calm, stay positive that I can do it. Okay, don't overthink. Like, I can see that many of you are overthinking at the moment as well. Okay, this can be the, don't make scenarios in your head. Mark my words. Okay, remember this thing. Don't make scenarios in your head that, okay, he may be asking this, she may be asking this, this can be this can be anything whatsoever. But always focus on what is your task, what are your domains, what exactly is role player asking you, what exactly role player is guiding you through. Okay, so don't make, the scenarios in your head that, okay, it can be like this because I have heard from that group, I have heard from that, the particular person, I have, prepared with this. See, everybody has different perspective of understanding, the so many things. By the time you are out of the exam, your thoughts are going to be scattered. You will be thinking about, how I performed, what I said in that station. Then, if you are going to discuss with, the couple of candidates, what will happen is the things are going to be, kind of, what I can say, the mixed up. So you will end up in, the thinking, maybe, she is correct, maybe he is correct, so I am wrong. Just stay calm. Okay, stay calm before exam. This is very much important. Plus, don't overthink that, I have to be 100%. This exam needs, for the last, I think 3 to 4 years, even since 2018, since I'm in this, the part 3. So it is, the exam percentage is not more than, the 62, 63. Okay. So it's been like 61, 62, 63, constant. Even at one time it was 60% as well. So don't always, I'm not saying that, just, the aim for 60, because percentage has nothing to do with your final score. Either you have to just pass or either you just have to fail. Okay. Percentage is your satisfaction. But what you need to do is that don't think that, because the, the etc. person, the he or she scored, the 92%. So I have to score the same. Don't always compare yourself with, the anyone. We don't know, the what someone is going through. We don't know, the what someone is passing through, the tough time, difficult time, hard time, this exam itself is a very, the tough, the call for everyone there is, isn't it? Online stress, well, the travel stress, the financial burden, emotional burden. We are away from our houses, we are away from our family, our kids, our loved ones, whatever. So this put, a lot of stress on everyone there is. So don't think that I have to be 100%. Just always think of that. See, I have to give my 100% into one station, not 100% in every station. I have to give my 100%, what I know about this station. All right. Secondly, don't compare yourself or your preparation with anyone around. Everybody has a different, the circumstance. We cannot fit in anyone's shoes. Yeah. We cannot be, I cannot be you, you cannot be me. You don't know if I'm talking here, so what I'm going through in the background. If you are talking to me now, I don't know what you are going through in your own life. Okay. So we don't need to compare anyone with anyone around. Don't think that you are inferior to anyone. This is what, I have been noticing these days, because I'm taking mocks, these days, quite frequently. So I really feel that, everyone should have a, the psychological booster session as well. Just on this thing, they shouldn't talk about, the how am I doing. There is any question in that recall, there was this, in that group it was this. Just talk about your fears, just talk about your anxieties, just talk about, what exactly are you thinking at the moment. So trust me, these days I'm really thinking that, every candidate should have that session as well. This is very much important. Don't think that you are inferior to anyone. You yourself are unique. You can do, you have been through a lot. You are here because of your own efforts, right? Someone can guide you, but someone cannot be you, and you cannot be someone as well. Plus, don't you ever think that, I am going for this exam to just pass it. Okay. If you will have this, the mark in your head that, I just have to pass, I just have to pass. I don't want to fail. Certainly, nobody wants to fail. But, if you will fix your mind into this, that no, so your mind will be, the exhausted by the end. By the end of thorough, the rehearsal, it will be very much exhausted. It will be, the kind of not in your, the own control. So if anything whatsoever happens, so it is going to affect you badly. Okay. So just stay calm, leave yourself, leave your nerves. Okay. Just think that, okay, I can do it. I will give my 100%. I don't care about the results later. Okay. I will just go for the exam, because going for exam itself is a big deal. Okay. Because it needs a lot of courage. If you guys are traveling, if you guys are in online exam, this way or that way, it's a stress. Okay. So just, be yourself, stay calm, stay positive that I can do it. And don't just think that, I just have to be 100%. I have to be, I cannot do any mistake. Everybody can do mistake. Okay. While I failed, this exam, I was like, how I can fail this exam? Yes, but I have failed. So what? So what? Yes, it bothered me a lot. It affected me badly, because I've been, I was going through so many things at that time. Okay. But, doesn't matter, you have to get up. You have to get up. Okay. You have to do, whatever you want to do. Can we do ECV in second one? Of course you can do. So it is ECV you can do in transverse line. Okay. No problem.
Hello, madam. I have a question.
Dr. Zaib. Hello.
Hello.
Yes. Yes, Jijin, how are you?
Long time no see. Thank you for let me talk.
You're breaking up, Jijin. There is a lot of distortion, my dear.
Ma'am, I have a question. Okay.
Just wait.
Hello.
Yes, now it is okay.
Okay, thank you. So I have 3 questions. All of them are from the recall stations. First one is mother with Alzheimer and with postmenopausal bleeding. So how should we approach if we communicate with her doctor?
So you are going to ask her that, how long is she having this problem? Okay, is she with any kind of consultant? Is she on any treatment? And has she given you any advance directive? Has she given you any lasting power of attorney? Has she given, the before, the falling sick that, how was she before, the falling sick? If she is like, for the last 2 to 3 years, if she is like this, so before that, was she okay? Okay. Do you have any kind of, the lasting power? If no, if the answer is no, then you will take, the legal, the permission to do the, the treatment. If she's saying that,
So shall we ask for, let's say, consent?
Yes.
Because So how should we approach?
Consent in the sense you will assess yourself that whether is she having Alzheimer or no. You can simply ask, it's not like that, you are going to ask the consent directly. You are going to judge from the questions, okay? You can simply ask that, hello, how are you? Can I know your name? If she can recall, it is okay. If she cannot recall, so can I ask that what is, bothering you? If she can tell you something, then okay. You are going to talk to her. You are going to convey your, the message. What is valid consent? Valid consent is when the person in front of you can understand, can comprehend, and can repeat the same information. Okay, that is going to be valid consent. If you are talking in terms of consent, okay. So if somebody cannot give any kind of consent, then yes, you are going to ask in terms of, the lasting power of attorney, any, what was that? The advance directive. Okay, if she has given you any kind of, the directions that, okay, sometimes it happens. Okay, so the people, they give their, the kind of, the will that, okay, if I fall sick, so the person, the who is this, the who is related to me, so he or she will take care of me. Okay, so in case of, the any problem, so he or she will take care of me. So this happens. This is normal.
Okay, second question. 9-year-old girl with urinary retention, and it turned out to be the HSV infection. I want to know more about the patient safety part, because there's no standard answer for that.
See, patient safety is going to be, first of all, you need to be very gentle. You are going to talk to the woman, the mother, okay, who is with the daughter, and you are going to gently inquire from the baby as well, okay, in the presence of forensic expert. Okay, so then you are going to, the inquire, you are going to gently ask that, can I ask them, since how long are you having this? Okay, and you are going to ask the mother, or maybe, the baby as well, that, how is this the very first time? Has it happened before as well or no? Then you are going to ask that, the girl, you can ask that, has anybody tried to give you any kind of, the chocolates and kind of gifts, any kind of, the chocolates or gifts? Usually, the kids are happy with that. Okay, so you can simply, they inquire in maybe not in so many words, but you can ask in such way. So patient safety here is going to be, of course, you are going to inquire about, the current complaint, presenting complaint. Then you are going to ask about, the history of presenting complaint. Then, of course, you are going to inquire. Then you are going to go about the examination. Then you are going to have the forensic expert. You are going to take swabs. You are going to relieve her urinary retention. You are going to give her antiviral therapy. You are going to give her analgesics. So that's all. This is almost, the complete applied clinical knowledge blended with patient safety. Okay.
Okay. So the third one, there's a saying that the labor ward prioritization only accounts, let's say, less than other, let's say, SPT or structure discussion station. Do you think it's true?
In terms of marks?
Yeah, marks. Yeah.
No. You will hear this from, the lead examiner. Every station carry equal marks, but every station has different key. For example, in one station, if you are not covering patient safety, you will fail. For example, in one station, this is all about, according to the RCOG key, that you have to talk about applied clinical knowledge. If you are not, the bringing your up to the mark applied clinical knowledge, so you will fail. Okay, so this is how exam is. Exam is not, the set according to our, the expectations and perspective.
Yeah, but the SPT with lay examiner is usually carry more marks, right?
See, lay examiner is something else. Lay examiner will have their own marks. But if in terms of, the station, so in terms of the station, so almost every station will carry equal marks. But if lay examiner has, for example, in one station or 4 stations, you can have lay examiners. So of course, lay examiner will give you, the additional marks if you have, the, fulfilled the criteria of the marks. Okay.
Okay, thank you.
Okay, good. Yes.
We faced patient that sexual assault. So
I can't hear you, sweetheart.
Sexual assault that doctor ST5 from labor ward. So the ST5 goes to the ER and asks that I'm ST5 and here you called me for evaluation of the case. After that, what we have to say, like this is teaching station, but how to start and means.
Okay, so you mean to say that teaching sexual assault to your junior?
Usually this is recalls that it was May, Feb, continuously repeating this station in online cases.
I don't think so.
Yeah, doctor called the labor room ST5 according to our
whatever. If you are here and you have been called by a junior and junior wants to talk to you about the sexual assault, so you will, they follow in the lines of teaching, okay, module. So you are going to ask that, okay, so I am, the one, don't say in teaching station, I am ST5 and you, okay. Simply say that, hello, I'm Dr. Hira, one of the doctor here. And can I ask your name? Yes. Okay, fine. So I understand that you want to learn a little bit about the sexual assault. Am I right? Yes. So can you please tell me, what exactly do you know about the sexual assault? Okay. So always remember, so in here as well.
Too about the learn, but just he said, I have attended this patient and.
Okay, ask her, ask him, ask her or him, whoever is that, okay, so you have seen this patient in the labor ward. Okay. So what was your, your thoughts about it? What do you think was it? Is it? You will ask, the background information, isn't it? So you will ask that, okay. So then you will, inquire her, okay. So according to you, what it could be. Then you can say that, okay, the diagnosis was sexual assault. Then you are going to tell her that, look, how we are going to, the carry out the sexual assault examination. Then you are going to go according to the talk article. Okay, that we have to collect swab, we have to give her prophylaxis, we have to give her, this, we are going to give her this. Then you are going to ask you, okay, so can you repeat it for me that, how it is going to be? How frequently we will do swabs, how frequently we will do this, like this.
Thank you, ma'am.
Teaching station is not going to be that, you are going to see acutely presenting patient and then you are going to do teaching. No. Usually teaching stations come, even if, if at all it comes, like, that that you are going to be seeing your, with one of the junior or the MRCOG-3 trainee who has seen, the some of the case lately, and he is very, the keen to learn about that case. Okay, so meet her and talk to her about that. So usually it is like that. Okay, so I'm afraid, some of the, the exam questions are circulating here and there are pretty, the pretty misguiding and, the kind of, I'm sorry to say stupid as well somewhere, So don't believe in everything, which is circulating here and there. Always think that if at all this question is coming, so how am I going to cover it? So every module has, the different kind of perspective. I think we have discussed quite, the all modules. So, just go through, the module by module. There is no hard and fast rule. Remember, there is no hard and fast rule that you have to finish your, the big template of the history, then you have to go accordingly. No. Okay. Okay. So let me go through that how to utilize. Welcome, Hira. So how to utilize last few days. So don't read any new thing. First thing first. For example, I did this mistake. I have never read, the one of the station and I did this mistake, then I failed this exam. I'm not saying that this was the only mistake, of course. The mistakes are on the day of exam. Mistakes are not before the, the day of the exam. But of course, we can minimize those things which can, the hamper our, the kind of ability to go for the exam day. Don't stop practicing as well. Don't do this mistake. Okay. At least you have to, and don't just listen to the different, the audios and the videos collected from here and there. What it is causing you? It is distracting you. Number one, it is taking a lot of time. Every video and audio is going to be like, the kind of hours and hours you are spending time. Okay, fair enough. If you really want to go through, so yes, if you have already made your notes, fair enough. Okay, revise them. But, don't touch new things. Don't compromise your health, sleep, appetite. Okay, sleep properly. Sleep properly. While in the end, in the last few days, if you are practicing, practice must station where you think, for example, the teaching station, some of the teaching stations, for example, the postpartum problem, collapse is a very good station. Collapse. So read guideline. This is important. Practice it. Collapse station can come anytime there is. Okay. So if you have exam for 9 days, so mark my words, collapse station will come, in any day. You cannot predict, nobody can predict, isn't it? So at least, you have to have, I'm sure, everybody have this idea after this thorough preparation that, what are the, the kind of hot, the questions which can come, which I think all doctors, we all are well versed of, since our MBBS time, isn't it? We always have, this kind of guess in our mind that, okay, this question is likely to come, this question is likely to be important. So I have to give, the little bit more importance. But again, do the take timer with you, 2 minutes, 10 minutes. Try to complete your station within 10 minutes, but better at 10 minutes or, the not more than 10 minutes. Okay. Because in the end, you have to be master on it. Practice at least 5 to 7 stations in a day. Don't just, put extra burden on yourself that I have to do 14 stations in a row every day. What it is causing headache, it is causing extra pressure, it is causing, a lot of, the nuisance to your, the own self as well, in terms of that, you are talking, sometimes, you get sore throat, sometimes you get, the problem. See, I am teaching, so I get frequent sore throat because I don't have voice rest. Okay. So sometimes, of course, I have to take, some of the precautions to, to keep myself, ready for all stations there is. So it doesn't necessarily mean that, all of you have to go through the same rehearsal every day, 14 stations every day. It is tiring. I myself have done that. I got so tired. I got so affected. My mental health was so bad that by the end of 14 stations, I used to say that, okay, come on, I'm not going for this exam anymore. This exam is not meant for me. I'm not going for this exam. I was in England at that time and I was thinking that, no, I'm not going to go for this exam, day after tomorrow or 2 days, before exam. So always remember, be easy on yourself. Okay. Be gentle on yourself as well. Okay. So don't punish yourself if you are in this exam. So you have to compare with somebody. If she is doing this, I have to do this. If he is doing this, I have to do this. No, everyone is different. Everyone has different habit to study, different habit to, absorb things. Some people, they need just, the one session. Some people need, the multiple session to absorb thing or, to read through, okay, the things. So don't compromise your health. Okay. If you are healthy, if you are in good state of mind, so of course you are going to be in a good position to go for exam. Okay. So, be very gentle on yourself. Then the exam day. So exam day is here. So, how you are going to do, the day before exam. Stop studying. Mark my words. Stop studying. Stop practicing. Have a walk in park or, if you think that, you can just walk in your own, the neighborhood or whatever. Spend time with your family, kids, pets, if you have any. Okay. I am, a pet lover. I missed my pets like anything, when I was in, the England. I used to miss my cat a lot. Okay. So everybody has, the comfort zone. Everybody needs, that comfort. Okay. And of course, if we are stressed out, we need, the comfort. As we are human beings. We are not robots. Okay. Take good sleep. At least 5 to 6 hours sleep is must, one day before exam. Proper meal, but don't overeat. Okay. Don't overeat and don't just, and don't overeat as well. This is very much important that, we have to keep ourselves, the very light, very, the normal as well. Again, I will say the same. We are human beings. Yeah. On the day of exam, get ready, get up early, pray if you want to. Okay. Exercise, meditate, have breakfast, good breakfast, tea, coffee. Don't revise anything on exam day. Please note it down. Don't revise anything. Leave yourself, the very relaxed. Your mind, your neurons need little bit of relaxation. And this is a physiology. And this is a physiological phenomena. Mind has a tendency to recall everything there is. Once you are going to be in that mode, exam mode, trust me, everything will be in your head at that time. Trust me. Okay. So don't, they bombard yourself with, the lot of revision. I have to do this. I have to do this. I have to do this. If you are going to, the face-to-face exam, don't take anything with you. You are not going to take any, the kind of time to revise anything, to open any book. No. Just take your IDs with you, relax, okay? Just as, everyone has, the different, the religious beliefs. So if you want to recite anything, with you yourself, okay, do that. Whichever thing, makes you calm. Some people, they save their energies by just, the sitting, by closing their eyes. Do that. Save your energies. Those 14 stations, those 3 hours are going to be the longest 3 hours, of life. Trust me. Okay. So just be easy on yourself. Get well dressed. Okay. Be very, the kind of poised, very good, the doctor. Okay. Plus, in terms of dressing, I just got the direct message that, for the dressing, you need to be very kind of, the normal person like you are in your day-to-day life. Don't wear, the fancy stuff. Don't wear, a lot of makeup. Don't wear a lot of, the jewelry. Just be very, nice. Wear nice lipstick, lip color if you want to, and it looks good. If you are looking fresh, if you are looking good, so you will feel fresh yourself, and then the role player, she will feel good too. This is what we do, isn't it? While we are going to hospital, we are not going in our the PJs, right? We are getting well dressed, we are the making ourselves the kind of presentable. Likewise for the exam as well. Blue, black are neutral colors. So if you want to wear the blue, black, the any and be the be in formal dressing. Even in online exam, don't try to be in haste of the you are sitting in PJs in front of exam. No, come on, this is exam. Take it as an exam, even if it is online exam. Okay, be presentable. For the girls, if you want to take any kind of hijab or anything, so make sure it is fixed at here. You are not fixing it again and again. It looks the very lousy at that time. Okay, so don't the plus it should not be very the vibrant color, orange, pink, green, okay, red. No, avoid that. Neutral, the black, blue, white, off white, very very calm and the soothing colors, the colors which are the easy for the the eyes and everything. Likewise for the boys as well. So don't wear I have seen one boy while I was in UK, and he was native. So he was in pant, the jeans. I don't think that it is a good idea to wear jeans in exam if you are in face to face. Okay, you have to be in formal look. You have to be in professional look. This is exam. This is going to the change your life, of course, because once you are the confident in yourself, so of course you will feel good after passing the exam. So your entire well-being should be very calm and poised, starting from your own self to your attire, to your performance and everything. Exam day is here. Yeah. So yes, you can do it, isn't it? Don't panic. Don't panic. This way or that way you have to face. So getting stressed means that you are more likely to misread the question. Of course, we are human beings, like I always say. We are human beings. Okay, if I'm stressed, I won't be able to see anything in front of me. Maybe I have any kind of internet issue. Maybe I have login issue. Maybe I have the anything. So how I will be the coping with that? Likewise, in the face-to-face exam, if you are standing in the and yes, let me before I forget it, regarding shoes for the girls all out there, please girls, all of you, wear comfortable shoes. Don't wear heels. Okay. So in real exam, it feels so bad that everybody tuck 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 tuck, and you will remember my words in RCOG. It is going to be so noisy. It is going to be so noisy that by station number 10 you will have headache. Okay, so everybody needs to understand this, that we are in exam hall. Even if you are like in the heels, because you have to run from one cubicle to the other cubicle. Okay, you have to enter, you have to go, you have to sit, you have to stand, you have to go, you have to stand outside, and then you have to enter into the next cubicle as well. So we are comfortable. I did this mistake. I wore the very nice heels, so I was in myself, in me myself, I was the kind of very confident. But trust me, I got tired by station number 10. By station number 11, I was feeling that I have to take off my shoes, and I have to walk the bare feet. Okay, so be comfortable, be in comfortable attire, be in comfortable the poise for the boys as well. And plus, don't try new shoes on exam day. Okay, make sure that you have worn that shoes quite a couple of times, so your feet are not hurting at that time. Because of course you have to be in a very the calm poise. If your feet are hurting, you cannot walk the fast, you cannot move from one station to the other station. Okay, so don't be upset, don't panic on the exam day. Just relax, go to the exam hall. If it is the face-to-face exam, so again you will be called in one room. Okay, you will have ID check, and just sit there, wait for your turn, and then they will guide you through that how to go and where to go. If it is online, so make sure that you are going to be online. Okay, you will have all these checks. Okay, You will have all these checks, and then you are going to, they will let you enter. All right. So you will have all these checks. Your camera will be checked, your microphone, your connection, your, the activity, the Wi-Fi, everything. So you will have this message on your screen. Then you will be entered into the waiting room with the other room. Then your exam will start. Okay. So don't get bothered about this, that you have to do anything. It is going to be automatic. Screen will change on itself. You don't have to do anything. Okay. So make sure that, you are having, for the online peeps, you have to have the strong internet. Okay. You have to have, the full speed check. And I think you will get, the email in 1 or 2 days for the system check as well. Okay. So make sure that you have high speed internet and everything. And plus you have to have a laptop or the desktop. Exam is not allowed on phones, and exam is not allowed on, the iPad as well. Okay. And MacBook too. So make sure, you have a proper system placed. So at least you will not be bothered. Then in the 2 minutes time, this is very much important. Read tasks carefully. Situational awareness is very much important. The question given to you is, you are ST5 in urogynecology ward, and I am telling to the role player that, hello, I'm Dr. So-and-so, and I'm one of the doctor in the antenatal clinic today. Maybe it is not going to make any difference, but to me, I mean, it is not going to be that you are well aware of the situation where you are in. You are absent-minded doctor. Okay. So remember, for every 10 minutes, you have to prove yourself that you are equally capable, competent, and knowledgeable doctor, and a safe doctor as well. Okay. Safety is a prime importance for every station there is. Read task carefully, read through it, read it again and again. No need to write down everything. Just read question carefully, that, okay, this is this question, this is this question. So I have to, okay, this is 66. Okay. Don't verbalize. This is another mistake what candidate do. Don't verbalize or, just repeat it in your head. So because, you are having another candidate next to you, you are having another candidate next to you in the online, in the background, there are 4 or 5 examiners, who are watching you. Okay. They are, the reserve examiners. Okay. So make sure that, you are, the keeping everything in a streamline, in a very good way, in a poised way, and you are appearing as a very good and sound doctor. Check what domains are tested in this task. If information gathering is missing, Bismillah, say Alhamdulillah, because you are saved. You don't have to talk much. If the question is about, you just have to counsel the lady regarding so-and-so, and the information gathering domain is missing. You will just touch few of the points, not, the complete 4 and 5 pages history. You will just ask those relative questions which are important for your management only. Plus, don't start making keys. I'm in 2 minutes time. I will do this. I will do this. 2 minutes. How is it possible? I cannot do that. I didn't do that either. I had, the face-to-face exams, luckily. Okay. So don't start making keys that, I have to do this. I have to say this. Okay. You can revise it in your head that, okay, I have to do that. Okay. I have to do this, but how? Important thing is start. Sometimes, you can get a, the clue while you are starting the station. Sometimes if you are lost, if you think that, you are lost of words as well, that how am I going to start the station? Role player will guide you. Trust me, some of the role players are very helpful. They guide you through. If you are swaying here and there, if you are going, if you are detracking, they will guide you that, okay, look, I am here because, look, doctor, I'm having pain. So do you really think that, I have to just go home and, just take these antibiotics? If I'm in pain, okay, tell me something about my pain. Okay, relieve my pain. I'm here because of the pain. Pain is what? Pain is acute condition, isn't it? Plus, in the 2 minutes time, what else you can check is whether it is a referral letter, GP letter, midwife letter or no. Because by the end, while you are closing your loop, okay, because in the beginning you will say that, hello, I'm Dr. Qureshi, I'm the doctor in the antenatal clinic today. So I understand from your GP letter that you are having this, and you want to discuss about your labor plan. Am I right? Don't just read complete question to her. Okay. Don't just tell her that why you are here. Just tell her that, okay, I understand this. I understand this. I came to know from your letter this, that you want to discuss about this. Am I right? Okay. So is there any particular thing you want me to discuss first? Or is there anything you want me to discuss, in particular? Concern, ask her concern. Or you can ask in another way that, do you have any other, the concern apart from that? No, doctor, no. Okay. So please make sure that, you are having a proper agenda in your mind, but don't repeat question to her. Formulate how will you start the station. This is important. Starting the station is important. Then read question again and again. So you're not going to miss anything from, the station, that your agenda was that, your task was this, and you didn't fulfill your task. All right. Then in the 10 minutes time, this is also very much important. Enter into the cubicle very nicely. Okay. In the online exam, of course, you are sitting like this, like I'm sitting here. So you guys can see me. So likewise in online exam, you don't have to change. Plus in online exam, because I've been an examiner in online exam, what can they do is they because of the anxiety or something, this is normal habit. Some people, they scratch their head, they scratch here, they do this. This is an anxiety, right? And exam anxiety is real. Okay. So but try not to do that. Okay, try not to do that. Try to be, if you have finished your session, okay, just sit like this. Look at the screen. Don't look here and there. Don't just, do this. Don't do like this. Don't do unnecessary movements. All right. So look confident. Enter into the cubicle. Okay. So calmly, you will familiarize yourself with the cubicle. Who is sitting in the cubicle? Okay. I can see I have role player. I have, the examiner. I can see another, the person as well. So always think that, if I have another person, usually in SPT task, you will have, the two people in your cubicle. But if there are, the three people, so always imagine that this is going to be the lay examiner. So don't look at the examiner or lay examiner at all. Just maintain eye-to-eye contact with role player only. Okay. And it has to be, the eye-to-eye contact. It should not be like this, you are staring at here, you are staring here, and you are not, talking to her. All the time, it is very much important that, you are focusing on patient, role player, rather than examiner. If you have said something and you are proud of yourself, that, oh yeah, I have covered this point because this is from patient safety. So you are looking at the examiner that, okay, he's pat me. Oh yeah, good luck. You have done, the very good. Don't expect any expression. Don't expect any pat. Don't expect any kind of wow. Don't expect any well done, excellent, good, from any examiner. Nobody is going to say that. So don't expect that. Okay. So just stay neutral, stay focused, just focus on role player. Try to finish your task with the respective domains. Like I have said, that if information gathering is not there, so always say, thank God, information gathering is not there. I'm saved. Okay. So even if you have finished your station before the bell rings, sit comfortably like you are sitting. Don't exchange, the glances. Don't smile. Don't look, like this, and don't do, the faces. Don't do anything. Don't do any unnecessary things. And anxiety is real, like I have said earlier. And anxiety is very real. Okay, but this is what our exam is. This is not the exam of only. This is exam of our nerves. Okay. So make sure that you are into the kind of aura where you can have a good command on yourself, your actions, your behavior, your emotions, and your the expressions as well, because this exam is going to be about your overall one being. Okay, how good a person is, the doctor is. If you are not listening, and yes, another important thing, please make a habit that you listen to role player attentively, and give your the some kinds of the humming as well, like I see, I'm so sorry that you have been through this, it must have been painful, yeah. I understand, it must be kind of the very hurtful, yeah. I'm so sorry that you have to go through this. Okay, so at least acknowledge someone's pain. If somebody is saying, doctor, I had this, and I had this, and you are just I know you definitely ask something, but show there and then. Okay, show there and then that, okay, you care for her and you are here for her only. You want to give her the advice, and you want to listen to her as well. All right, clear everyone? Any question? Any other question?
Excuse me, Dr. Zaib, please, last question. Can you explain about the hysterectomy clamp that in the pedicle, which one will use, the name and the carb also.
Curve plan, hysterectomy clamps? I didn't get it.
The
in,
name.
in what sense?
The name of the hysterectomy clamp in the pedicle. In the pedicle, hysterectomy.
You mean to say that, you know, the names, of course, we do the curved clamps. Okay, we will fix the, you know, the uterus with the help of the, you know, the straight clamps. We will first of all, you know, we will do the, you know, the, then for the, you know, the arteries, always remember that is going to be the, you know, the clamp, curved clamp, small clamp, Zeppelin for step. Okay.
The name of the hysterectomy clamp.
Name of the hysterectomy clamps.
Like Zeppelin will use the uterine vessel, Zeppelin clamp.
That is Zeppelin or Heney's
Zeppelin.
forceps, or, you know, the Heney's clamp or the Zeppelin clamp, because they are smooth. Because for the arteries, you have to be, you know, the little gentle. Okay. So it is going to be that Heney's clamp or, you know, the Zeppelin clamp, you know, somewhat like that.
So round ligament, which one will use? Round ligament.
Round ligament is tough. Okay. So that can be the Cocker. Okay. Curved clamp.
Yes. And uterosacral?
Uterosacral is where? Uterosacral, you need curved. As long as you are going into the pelvic cavity, you need curved clamps. As long as you are in abdominal cavity, you need straight clamps.
Name, which one will be the uterosacral?
Uterosacral, I don't know. There are, you know, the different names for every clamp there is.
Yeah.
I don't know. I'm sorry. I don't know what are you talking about. But, you know, I don't, you know, the...
There is a name for every separately.
Okay, maybe I don't want to mislead, but, you know, this is, you know, the exam question of part 2 rather than part 3, if I'm not wrong. Because in the real exam, if they're asking you for the hysterectomy clamps, you will go through how you do, you know, clinically. Can you differentiate between Heney's clamp, and can you differentiate between Zeppelin clamp and everything?
They'll give you the clamp and they'll tell that to use it and how to, each clamp you will use which pedicle, and they'll tell that to tell the name also.
Okay, then you can read through. I'm sorry, you know, I cannot mislead. I don't want to mislead. Then you can read through from any text.
Thank you.
There is, you know, the course RCOG basic practical skills.
Yeah.
If it is the book, then, you know, we can do it. Let me check hysterectomy if we do have any clamps name. Let me check. because check. Okay, any other question, guys? Till then I you know, the search for it.
Yes, Dr. Zaib, I want to ask, I'm Rizwana. I want to ask that the question which is written outside the cubicle, will it be available on the desk inside?
Yes, all the time. Even in the online exam, it will be in front of you. Even in the, you know, the on-site exam, it will be on the table. Okay? Oh, don't worry about it. Yes. Anytime you can scroll through, anytime you can look at, and yes, for the name of the patient as well. For example, you know, sometimes if we from, you know, the, you know, the from previous patient, I have seen, you know, the Clara, and in the next patient, I'm seeing Maria. So sometimes, you know, what happens is that, you know, we do talk about that, okay, you know, because of the, you know, so anytime if you have, you know, realized that, you know, you have named her with the previous name, so you can always say, you know, I'm sorry, can I check your name and date, please, again, okay? So don't, I mean, be adamant that you have to repeat the same name, rather than, you know, it's a good idea that you will ask her that, I'm so sorry, I forgot your name. Can you please tell me your name again? You know, it's a good idea that, you know, you have to do this. And I think this is what we do in real life as well, isn't it?
Yeah, thank you.
It's not in this book. I'm sorry, Salma. It's not in this book, hysterectomy book. So you may have to go through, you know, maybe any of the video, because it's not, you know, up to my knowledge, because for me clinically it is very difficult, you know, how you are going to differentiate between, you know, many clamps. Okay.
No, it's okay. Thank you very much.
Okay, fine. Okay, great. Any other question? Any other question?
Ma'am, Faiza here.
Yes.
Ma'am, I need to ask that, for example, if I read somewhere there was a scenario, if like you call your senior or you're on call for help in any surgery or with the management of any particular patient, and you feel like that the person or the senior consultant or registrar, whoever it is, for example, supposedly they are like drunk, or they had like some drugs, and you feel like although they have managed the situation, but as the patient safety is at risk, so you need to report it to someone. So in first place, whether we are going to like confront them because they are our seniors, we can't do it. So how can we like,
You are going to
tell the
escalate.
authority?
You are going to at least tell, the someone who is, the ultimate senior, then that consultant. Okay. So at least you have to tell, that consultant. You have to tell your ward, the kind of whoever is making rota manager. Okay. You have to tell to your, the ward director, or can say, the ward in charge, or anyone, who is in with your ward. Because then, of course, if he's drunk today, so maybe, I mean, you have noticed. So if he is coming, the drunk any other day when you are not there, so yes, safety is going to be hampered. Not only patients, his himself as well, other people as well. Okay.
Okay.
You are going to escalate, of course.
Ma'am, and regarding the in utero transfer, can you just briefly tell that what is level 1, 2, and 3? Which patients are there that we need to like send those to level 3 tertiary care? The babies.
Level 3 tertiary care, of course, if you think that, the ward is full, there is no incubator at all. And where you think that, for the level 3, where you think that the baby needs ventilator as well. It is same like, the adult. Okay. It is same like adult, in which, you feel that the baby needs ventilatory support. Okay. Baby can go for the ventilatory support. Then yes, level 3 is going to be there. But yes, if baby needs only NICU care, only NICU care, then yes, it is going to be simple. Like for example, your ward is full. There is no other, the incubator available. And then yes, you have to do the in utero transfer.
Okay, ma'am. Thank you.
Okay. Okay, great. Okay, thank you, Priya. Thank you so much. So if you guys have any other query, any questions, do ask. Otherwise, make sure that you are okay, you are in good spirits, you are in good health, you are going with good, this notion that you can do it. Okay. So just be yourself. This is going to be my last tip. Just be yourself. Don't, get intimidated by anyone. Don't be upset, and don't just try to, the kind of, the repeat, what you have learned. Just be yourself, whatever comes in your mind, because in that particular aura, you yourself are going to be there. Okay. So nobody is going to see you. Nobody is going to judge you. Nobody is going to ask you anything. So that's it. So all the very best from my side. Okay. So all of you guys are amazing. All of you guys have been studying. So don't get bothered about, the tiny stuff, which is not, the important. Trust me, don't go here and there. Whatever your question is, just be on that. Okay. Just be on that. Just try to answer that. Okay. So in terms of, there can be multiple things which maybe you never have, the studied. So don't worry about that. Whatever you have studied, at least be confident that, okay, whatever I know it with the best of my knowledge. Okay. I know this is written in that org article. I know it is written in that, the guideline. All right. Welcome. All the prayers are with you guys. Welcome. Thank you so, sweetheart. So inshallah, all of you guys are going to be good. Okay, if you guys have any query, do write to me. I will try to be, because at the very moment, trust me, I don't misguide. Okay, I don't, I'm not going to tell you that, no, you have studied wrong. Okay, maybe, you are more well-read than me. Okay, because, I have so many things in my mind. So maybe, I cannot give, the 100% answer, because at the very same time, I'm not going to tell you, no, you are wrong. Okay, because I don't want to, the kind of, what you can say, that demoralize you. Your morale should be very high. Okay. So again, I will repeat the same. Be yourself. Okay. Be yourself. All the very best from my side. Okay. And go and, ace this exam. All right. Thank you. Thank you so much, everyone. All the very best. Bye-bye. Allah Hafiz.